I'm very happy to be moderating today. What is quite nice and how the whole day has been structured is that we're the third panel of the day. We had the first initial panel, which was the European perspectives, where we had kind of different debates coming out of different nation states in Europe. And then what we did in the second panel was we narrowed it then down to Germany, where we looked at the issue of isolation and what social distancing means in times of COVID-19 for LGBTQI refugees, and how difficult it has been for people to navigate the structures which are already difficult in themselves, but through such a pandemic. So this leads us wonderfully onto our panel today, which asks us to look at what options and access we have to community and health and legal support, what is still available actually in this LGBTQI plus refugees seeking asylum to seek and to be able to have access to adequate healthcare, and what the specific concerns are within the LGBTQI spectrum as well, right? Because there is this the issue of how LGBTQI groups are then homogenized. So that would be quite good if we could go into that today. So before I come on and introduce our wonderful panelists, I would like to actually come on to the housekeeping rules, as we call it. The session is 1 hour. We have 40 minutes questions and then 20 minutes for Q&A. And for the audience that is watching right now, you'll be able to submit questions anonymously via the Zoom webinar chat function throughout the webinar. Please be aware though that we will not be able to answer all questions because there is usually quite a high demand. And so we apologize in advance if your question doesn't get the time, but then there is a session later, which a counselling session, which one can tune into and post questions as well. We would also ask you not to put in any case specific questions because we cannot offer that currently individually. If you need advice regarding your case, please visit the Queer European Asylum website under www.queereuropeanasylum.org, where you find some useful links. Follow us on Twitter at Queer Euro Asylum and tweet about the symposium using hashtag COVID-19 Queer Asylum. And this symposium is also live streamed on our Facebook page as well. And finally, I'd like to mention that each panel of this symposium has its own Zoom link, which you find in a message sent to you via your Eventbrite registration. So that's to the housekeeping rules. So now I can come on to the wonderful panelists that I have sitting next to me, with me online. First of all, I'll start with Mira. Hi, Mira. Hey. Mira is very happy that you're here. Mira, in your bio, you say you are a Syrian LGBTQI activist and a project worker in Stuttgart and a peer counsellor at the LGBTQI network of Baden-Württemberg. So welcome, lovely to have you here. And then we come on to Ahmed. Ahmed Awadalla is an activist, educator, psychosocial worker and writer from Egypt. Ahmed holds a degree in pharmaceutical studies, and for the last decade their work has focused on intersections between health, sexuality and migration. Ahmed is currently working at the Berliner Aidshilfe and Checkpoint BLN, providing counselling and information on HIV, AIDS and sexual health. He's also engaged in anti-racist activism, particularly from a queer refugee perspective or perspectives. Their writing has been featured in several platforms and can be accessed on their blog, Rebel with a Cause. So we have the third panelist, Hannah, who was going to join us today for the panel, but unfortunately they cannot make it. But we do plan to keep in touch with Hannah and work on further projects with them as well. So we have now the benefit of talking with you two, Ahmed and Mira, a little bit more in detail, so to speak. And I think we can kind of focus a lot more on the NGO landscape and questions. So we're going to structure it in that way that we kind of go in that from that side. So I would like to kick off now with the first round of questions. And I would like to both ask you, what are the concerns that arise with COVID-19, particularly for refugees who are becoming increasingly cut off from social and legal services? And if we think of the last panel that we were, Ibrahim said, you know, this is not a new issue, actually. I'd like to both ask you, what are your observations and what are your concerns right now?
Just who should start?
Mira, you can start.
Okay, cool. I mean, the situation here in Baden-Württemberg, it's a little bit different than other maybe regions in Germany, because we don't really have that much access to the social service for LGBTQ community. So we have like specific points that you can get social. So it's anyway not that social and not really accessible for refugees to have some community or support anyway here. And since the situation with COVID-19 started, it started to become a little bit more difficult actually for people who are still at the asylum procedure, or people that also like got Duldung or so. They don't really speak any English, German, or any language that could help them to communicate. So that made the isolation even higher, because they now also can't communicate with organizations that they've been, for example, in contact with concerning having some support, because every place is closed right now. And actually, I also work with some people that they do some sex work or prostitution as well, in addition to my job. And that made it really also horrible for them, because some of them, they already live with HIV somehow. And they also like, you know, it will the trigger if will that affect our living with HIV, because it's like nothing really clear with this virus yet. So maybe like in addition with HIV, that would be really horrible. So they got also no place to speak this out. And mainly I'm having much more phone calls right now that just for sharing sometimes, not to have any kind of help. Yeah.
Ahmed.
Hi, everybody. Thank you, Harpreet, for the introduction. And thanks for inviting me to be here in this online panel. If you happen to hear some noise, just consider it the soundtrack of Berlin. I'm sitting right now at the office in Hermannplatz, so kind of like we are in the heart of Berlin right now. So there might be some noises in the background. Excuse me for that. Yeah, I mean, what the current pandemic means for queer refugees, of course, like that's not kind of like it's what is queer about this? What is the refugee perspective about this? You already mentioned, Harpreet, that we're always kind of trying to counter this narrative that refugees are a homogeneous group. So there are people who are living in refugee camps, and they have, of course, like the situation that their freedom of movement is already limited and has been made more limited by that situation. And for them, for people living in the refugee camps, there has been this campaign or this hashtags, stay at home, practice social distancing, and of course, people don't think of social distancing that actually as a that's not actually an option for a lot of people. Refugees who are in refugee camps, or people also who are homeless, this is already not an option, and the option to kind of practice this distancing from other people is already not there. And if we're talking about the queer thing, there has been kind of a discussion of like what does it mean to be queer in the pandemic, and are queer people affected in different ways? And yeah, it's an interesting conversation, because I think for a lot of queer people, we have kind of built networks that exists in so many different levels, including, for example, like nightlife activities, including groups, including spaces where people hang out, even in public spaces. Like the weather is getting better now, people are usually coming out in parks and getting in groups. So this kind of like this queer community comes around being in a physical space with each other. And that has been definitely not an option for a lot of people now. And that's why I would always say, yeah, for some people, isolation can be more dangerous than the pandemic itself, than the coronavirus, because obviously we're seeing a rise of mental health issues that are happening because of increased anxiety, increased also like people who already have mental health issues are definitely more affected with this. So yeah, that's maybe like initial thoughts about how things are changing right now.
Ahmed, you bring up, and both of you, Mira as well, you bring up this intersectional challenge that we have, right? So first of all, being LGBTQI, and then also being a refugee. And we see a certain kind of framing, right? Like Ahmed, you just said that as well, right? In the discourse where we're talking about social distancing, and as you rightfully say, right, that it's actually for many people a privilege to be able to do social distancing and stuff like that. So I have a question as well, leading on from that is, how do you, or perhaps we can go into more detail, how do you perceive the current framing of this crisis, right? What factors are missing in the debate? I'd like us to go in a little bit more into that topic. Ahmed.
Yeah, I would just maybe share a little anecdote of situation that happened a few weeks ago. I work at the Aidshilfe, so in my work, I work with people who are HIV positive or affected with HIV in different ways. And I accompany them to different services, including doctor offices and government offices. In that situation, I try to facilitate the access for people because, as everybody know, like people who just arrived here don't speak German, and that's a big barrier for a lot of access issues. And especially with people living with HIV, that's a challenge because they cannot rely on their community to support them because they need to usually hide their status. And that's also a case for a lot of queer people in general. So the kind of confidentiality breach, that's very important for us. And in this kind of situations, it's sometimes kind of like a really difficult job because not only kind of like see secondhand maybe like kind of discrimination that happens to the clients that I'm working with. This situation happened actually in the beginning of the quarantine, and I was with a client from Eritrea. We have been to a doctor office, and they have had put on in the entrance of the clinic kind of like a dispenser for a disinfectant. And once we entered the room together, people, including patients, went over to him, pointed at him, and told him, "You need to disinfect your hands now." And I already have translated that to him, so he already did that. And this situation has been repeated during that hour 4 times, including from the staff, but also from other patients. And I would call this kind of some sort of profiling, because why is the only Black man in the room being targeted and being approached in that way? And the problem with that it's not only happening from patients or other users of the space, but it's also happening from the staff. So this kind of reveals the bias that is happening within the medical staff, even bearing in mind that when we're talking about prevention in terms of the coronavirus, hand washing is the way to actually prevent infection and not a disinfectant. So there is this kind of slippages that happen between kind of like medical knowledge and biases, or kind of like social forms of discrimination. And I'm sharing that because when we're talking about this kind of pandemic situation, of course, there is this discussion that it tends to be kind of like medical in nature, in health and nature, and I want to broaden our understanding of health, what it means to access health services, what it means for people who belong to racial group minorities or who don't speak the languages, and what happens to them while they're trying to access those services. And of course, that's also a narrative that is happening from a lot of people I know, and people from racial minorities, especially from Asian backgrounds, that have been increased attacks and violence against them in the last couple of months. So I think in this kind of conversation, we're talking about this fear a lot of how to kind of like fight the virus, but we're not thinking a lot about what are the costs of fighting the virus, and this fear, how is it clouding our judgments and causing other kind of risky situations and vulnerabilities for people.
Mira, what would you say? What's your perspective?
I would actually like to add something, because what he just said is quite interesting, because I've just had a phone call with a client right before we start our panel, and it was pretty complicated as well. He came from Syria like only 4 months ago, so he absolutely speaks no German. He has no knowledge about the country or anything, and he's a trans man, so he had some like difficulties also like with being a trans and going through the health system here, but also like he had some real pain because of, you know, like the hormones and so that he used, and he wanted to go to a doctor, and the doctor first rejected him. They said, you are not a woman, because he had to go to a woman doctor or a female doctor. They said, you are not a woman, you are not allowed to come here. And then he said, like, here's my ID, and I just would like to check. I'm a woman, so why should I come here? They said, no, you're not a woman. What are you doing here? And then they said like something like about this Arab boy who's trying to disturb their clinic. And then they didn't allow him to enter. Then a social worker tried to contact them again, and then to say that he's a trans man, but he's a woman and so on. And then he said, okay, I will try again because I really have pain. Afterwards, I was on the phone today with him because he also was with a friend who speaks English to translate, and they said we allow only one person to be at the clinic at one time. And then he said like, okay, I can't really do it by myself. I don't really speak any foreign language, and I really have pain. I can't sleep. They said, we are really sorry. We can't really help you anyway. And then he called me and he was crying and he was telling, okay, what should I do right now? I was trying just to contact the secretary there, and then she rejected actually talking to me on the phone. So I called her to the phone, actually, like to the clinic phone. And then I said, like, why are you trying to do this discrimination right now? He has pain, he needs to get healed. He can't do anything to the language, and he needs only somebody to be beside him. Nobody else is there, and nobody's just coming with him inside because you're not allowing everyone. So what can he do right now? He has been living with this pain now for 3 months, and finally when he got the chance to just have something to check it or just deal with it in a better way, you are just preventing him from having this opportunity. And yeah, I'm still a little bit affected till now because it was such a harsh experience for anyone to live. And yeah, it just happened like 5 minutes ago or so.
Oh gosh, and then you just came straight into the panel. Yeah, but this is the thing, right? This is you are the people working on the ground. You're doing the case studies. You're able to see what is going on, what's going on in the majority society, what is going on, which you both have mentioned as well. The kind of behaviour that medical staff or people within official structures have towards LGBTQI refugees. So that's something quite interesting that I hear from both of you as well. And what would you say, what can one do now? I mean, in the sense of when we have these situations with the medical staff, and then you have the topic of language as well, because Mira, you mentioned that initially at the beginning as well. right?
Yeah, yeah.
And I remember in our pre-talks, we were talking a little bit about the issue of language, and language has been mentioned also in the previous panel. What do you see? What are the difficulties there?
I mean, if we are talking about isolation, so language and communication is actually the way to stop isolation somehow. When you are able to communicate by yourself with other sources of help or with other people, or be surrounded by people that at least you can communicate in a comfortable way with, using a language that maybe you need to find people that they better understand you than others, then of course maybe the isolation will be less. But like, since now we are talking about people that they don't really speak any German or any English somehow, and then like you are coming and trying also to deal with some people that they should give them some services and they're not even sensitive to the way that they should communicate. So let's avoid the language for a moment now. So they are not really even aware of the way that they communicate with foreigners somehow, or to respect other people's background somehow. So they just, as Ahmed just mentioned, like only because somebody's looking Middle Eastern or Asian Black, they are just expecting him to be not really taking care of his health, for example, or not really taking care of the whole situation right now, or like having any kind of, you know, infection prevention rules or so. And it's actually something that I'm really facing nowadays, because each time I'm translating for a client through the phone or so, I'm always asked again to ask the client to wash his hand or like to use some anti-infection or so, and he has just done, for example. So what are you asking people to do? And then afterwards, again, like if you are talking about the language that people are also like speaking, they don't really care about like the way their language is understandable or not. So they speak sometimes, like here we have a regional dialect, it's called Schwäbisch, which is like a very kind of harsh German dialect. I like it personally, but you can't really understand it even if you've been to German courses. So it's totally different than Hochdeutsch, and nobody's actually caring about these people that they need some service right now from you. And okay, then clients, okay, we had the appointment, but nothing happened. And they also don't go to social points sometimes because nobody's also respecting the way they would like to express themselves, and or in which language do they feel comfortable to communicate. And yeah.
Ahmed, what's your experience on the issue of language? Because you've spoken about this situation, this totally dehumanizing, let's put it quite frankly, situation for this person where they're experiencing racism, or even groups of people that are experiencing even more racism than before. What is your, how do you see that with the issue of language as well in your work?
I mean, yeah, so as I mentioned before, language is a big barrier in Germany, is prides itself on having one of the best healthcare systems in the world. However, that's usually seen from the perspective of people who are citizens, or people who speak the language and have that kind of maybe kind of like that privilege to navigate the system in ways that people who don't speak the language do. And we can also see now our work is much limited, and the Aidshilfe, we have restructured our work in ways that we only offer Notberatung, so like kind of emergency counseling, and we have stopped their testing services. We're trying to reach out to people, and we have a team because we are in Berlin here, so it's a pretty diverse, and we also like kind of a bigger diverse team, trying to reach out to people with different languages. There has been a service that has been set up here in Berlin to provide, like there was a corona hotline, coronavirus hotline that has been set up by Berlin here. And I've been trying to use all my channels to kind of promote those phone numbers. And every day they have 2-hour slots for each language, which means, for example, like Arabic speakers can only call on Thursday from 10 to 12, which is still like it's a step forward, definitely, that we have like this kind of hotline. However, that's also still limited. So we're trying to be present with people on the phone because obviously we cannot, a lot of our work has been reduced to kind of like phone communication and online communication. I gave my first counseling yesterday because we're continuing our services here at Checkpoint Berlin. People who still need to access healthcare services, we're trying to kind of like do kind of Zoom meetings while they are in the doctor office. And of course that depends a lot on the doctors themselves and like what kind of facility and how much open and welcoming to the kind of this situation to happen, because also they have a lot of restraints in terms of time and energy to work with clients.
I was just thinking, like you just mentioned, there is this like Notberatung, and you said there's a diverse team that's able to kind of reach out to people in different languages, and you're making a step forward at least to be available, right, to provide services for people that require it. And I was thinking about this when I was conceptualizing the panel as well, and we spoke about it as well, is that's Berlin. And Berlin is the capital city of Germany. It has a different kind of NGO landscape. I even know that from Frankfurt. It's much more diverse, it's bigger. So Mira, I would ask you, how does it look like structurally in a place or in a smaller city in Baden-Württemberg?
Well, basically, we only have like organizations in a bigger city like Stuttgart, Mannheim, Heidelberg, maybe Freiburg, but I mean, at the rest of the cities, you don't really have much support. So sometimes you just have like the normal Caritas or Diaconie offices that sometimes the social worker is thinking of maybe referring a client to us or not. But for example, like in Stuttgart, for example, like we have several tiny organizations, if we can say. So they are not really so active, even they are really trying to make a hard work, but also we don't really have that much good base, because also like we miss actually the connection between each other. So like other regional organizations as well. For example, we have in Mannheim, we have Plus. It's one of the biggest ones here in Baden-Württemberg, and they are really active. So they have psychological support, they have legal support, and they have like kind of peer groups and like, yeah, solidarity groups or so. It's nice. Here in Stuttgart, we have like several smaller points that, I mean, it's more specific. So we have little group for trans people, and like little group for people that do sex work or prostitution. And we have like some meeting which is, it's supposed to be diverse somehow, so it's much more open, but actually you can see that the theme of this points or groups are totally kind of German. So like you don't really have this kind of huge diverse atmosphere there. So if you are just a refugee who's just arrived and you try to find some community for yourself, then you only find like this like little points that they are already for German people. We have like, actually I should mention at the Jugendliche Verein, we have Café Strichpunkt also. It's really diverse. It's for people that they do sex work and prostitution, and it's really diverse there. So you can find people from all over the world somehow just like gathering and eating together and like sharing things, and it's very nice there. But actually it's almost the only real diverse atmosphere that you can feel yourself really belonging to. But the other points are really kind of really limited, actually also with the help. So they try, for example, then to refer you to another social organization, like a bigger one, like Caritas, Diaconie or so. So you don't really have a real also ability to help people through your own work somehow, unfortunately. Yeah.
So you hear like kind of the structures between Berlin and Stuttgart, and you were also mentioning as well, Mira, the solidarity as well, right? Like there's lots of people in the society, you were saying, different groups within LGBT have like support groups, right? So I would like to connect that, because I've been in between looking at questions that are coming in. And I have a question from Pablo, because And Pablo's question, could you elaborate a little bit more on the issue talking about the solidarity groups and isolation, like you just mentioned, Mira? Is there something you could add more on the topic of mental health? Or your
I mean, the organization that I work at, basically, it's a collaboration of psychologists at Germany. So it's called the Lesbische. So for each psychologist who's interested in, or herself is having an LGBTQ background. And mainly now we are having a project to sensitize dolmetschers and people that also do some language services for the LGBTQ refugees. So we also have this kind of workshops, webinars, and so we try at in the first hand, we are trying to sensitize dolmetschers or people working with refugees to be aware of how to talk with them in a way that doesn't really affect their mental health in a bad way, or to be also like motivating for them, as they also have to do like long interviews sometimes for them, which is stressful anyway. At the other hand, I with my colleagues, we do counseling as well, that we mainly, it's like peer counseling. We have also like Jochen Kramer, he's also like a doctor in psychology. He does also some like a kind of therapy. He's a psychologist, and it's always about actually having some, okay, like let's say that people came out of some traumas in their life and they have PTSD sometimes, or they have also like some discrimination experiences that they are living right now at their accommodation, and their mental health is quite bad in a way that we talked about isolation, that they don't really find at the first point anybody to communicate with, or like at least to come out to. And then I always have this first 3 maybe counseling sessions only about talking, so that they just talk about what they've been through and how they've been feeling about it. And then afterwards, we just like try again, like to deal with the problem in a way, or we try, I mean, me personally, I'm not a psychologist, I'm a peer counselor, but I studied psychology for 2 years. So I haven't finished, and so I'm also like a life coach. So I try at least to do a little bit of, how can I say, like a better orientation for them to deal with the situation. But I just realized that afterwards, I mean, I made like, how can I say, like a clarity about the situation in Germany, which challenges could you face, how maybe it's better to deal with the situation or to react in a certain situation, but that never means that your trauma or your PTSD will be just gone, like so. And then again, we have this huge difficulty actually finding some psychiatrists or psychologists that they are capable to talk with people like of migrants background, or also sensitive to LGBTQ topics. And it's always the challenge. So I take it more on my side somehow. I try to ask also, like my boss is a psychologist, as I said, so I try sometime in combination to ask him if he can do some 2 extra sessions at least. But then it's really hard. And then again, we need somebody who's also sensitive to the topic to go and translate or interpret for them. And yeah, and then like we always have this, actually it's a dilemma, you know, like it goes up and then it goes down, and sometimes we share more with people, or me personally, I always try, okay, not to say no to people, even if it's much work for me now, or it's already gone with the allowed counseling hours, but people at least need to talk in case to be able to sleep sometimes. So it's really that hard.
So we're talking about this issue, and you've mentioned it as well, Mira, and Ahmed, you said it as well, that people in many cases do come to you for a source of comfort, right? So we are thinking of the issue of vulnerability. People are vulnerable. And what I still remember from our pre-talk, Ahmed, is you were mentioning this kind of construct of thinking about vulnerabilities and responsibilities. And I bring that in now because, Mira, you were talking about, and Ahmed, you said it as well before, how difficult it is that there's not enough sensibility or sensitivity from, let's say, people working within the field towards issues of LGBTQI refugees. And I would like us to kind of, because we're coming into the latter part of our panel now as well, to go a little bit more into that. Perhaps I can ask you now, Ahmed, when you were speaking about responsibilities and vulnerabilities. What do you mean by that?
Mm.
And what do we need to think about more?
I mean, I'm thinking about this kind of like concept of what happens in an epidemic and how we talk about it. And I think that has been happening in different epidemics, that we tend to think, in a way, we humans tend to think in kind of a binary way, where all those concepts, for example, vulnerability, a lot of the conversation when we were talking about the COVID-19 pandemic, that yeah, older people are more vulnerable and younger people are not so much, or people with previous health conditions as opposed to people who do not have previous health conditions. And on that idea, that kind of idea of vulnerability, this kind of binary that has been always kind of talked about, and this kind of focus and attention of age kind of maybe shifts away our attention from other ways people can be vulnerable. And the other point of responsibility is this kind of, again, this idea of social or physical distancing, and if people should be going out, if people should not be going out, if we can be in contact with other people, and that, again, idea of are you doing the responsible thing and not the responsible thing? And that's very kind of very tricky conversation, because it can put people in a position where they are being blamed for contacting other people, for going out, which is actually very counterproductive in this situation, because this kind of blaming, the stigmatizing is actually very, again, I'm very familiar with that from dealing with, like, coming from the AIDS epidemic. Bearing in mind, of course, there is a lot of different dynamics are at play here. However, the way we talk about it and the way we think and maybe kind of categorize this actions, I have seen people who are saying, like, if you go out, you're responsible for killing other people. And I just see that and I feel very concerned, because this kind of way of thinking is based on that binary of who's responsible and who's vulnerable, which is actually not accurate. And based on that, we think we fall into kind of traps of kind of stigmatizing and judging other people for their behavior without understanding the situation that they are already in. So so this kind of pattern repeats itself a lot when talking about epidemics, like falling into kind of binary ways of thinking.
If I can just stay on you, Ahmed, just quickly. You mentioned the HIV epidemic, right? And then, but Corona's different. Why is it different? Or how do you see, what do you see as different?
Yeah, I mean, it is a different situation because, of course, there is, it's a different virus, and HIV, I think, has been historically connected to sex and sexuality, and that brings the certain forms of stigmatization and discrimination that are connected to that. However, I think there is a lot of dynamics that are similar. If we are calling, like, coronavirus now the Asian virus, which has been in a lot of media and a lot of the conversation, the Chinese virus, we know that also the AIDS epidemic in the beginning, it was called the 4H virus, and 4H was people of Haitian background and hemophiles, heroin users, and homosexuals. So we always kind of tend in an epidemic to kind of like point fingers and blame a certain group for the kind of the spread or the originating of the virus, which of course is usually very far from like the truth of how viruses actually jump species from one animal to humans, etc. And another situation is, for example, that this situation happened recently in a refugee camp in a city called Zool, which is near Turingen, where people have been in, like some people have been tested positive for coronavirus in a refugee camp. And as a result of that, the police has raided, and people have been put into quarantine, which more than 500 people living in a refugee camp have been put into under quarantine. And some people have tried to get out of that, different reasons, maybe if they were aware, if they were not informed, because as in a result of that, police raided the refugee camp and arrested people. So they moved them from a refugee camp to actually a prison facility. And when I think of those kind of responses, I remember the HIV epidemic, because if you know, in Germany, so I'm thinking about this idea of how health or public health is being used as a precursor sometimes for violations of human rights of people and also their bodily autonomy. So, for example, in Germany, asylum seekers, when they come in certain kind of in certain states of Germany, we're talking about Bavaria and Saxony, they are forced to have an HIV test without their consent. And that's also, in a way, that's a violation of their autonomy and their freedom of choice, because how health approaches work, how they actually succeed, is when people are informed and are part of the decision making. So those kind of situations increase the kind of the stigma around asylum seekers and violate their choice. And this kind of dynamic of public health slipping into ways of controlling and surveillance and this kind of violent policies. For example, now, up until now in the AIDS epidemic, when it started in the 80s, countries have visa regulations for people living with HIV. So the people have to reveal their status. And some people are denied their visas, or they cannot have residence in many countries, including even in the United States until 2009, when President Obama changed that. So, and we are in a moment where a lot of policies are being changed, a lot of conversation about how to address this kind of situation. And I think we need to be very vigilant right now, so that we don't create policies that for the future also take like violate our human rights and our freedom of choice and movement and other rights.
Mira, I saw you nodding a few times whilst Ahmed was speaking. Would you like to add more to that, to the fears and what we need to be careful of now?
In which way specifically do you mean being careful?
Being careful of kind of the discourses, like Ahmed was talking, like the whole issue of autonomy, what laws are being made, surveillance issues and stuff like that.
Okay, I will go a little bit back to this point, but I just want to add something before I forget. I mean, HIV and coronavirus both are viruses and they are really connected somehow in the LGBTQ community, because also they use the shame of being HIV positive that people maybe started to deal with like slowly in a better way, but now again it came to the surface because people started to again engage being HIV positive with being not really caring about your health, let's say, and you're just sharing your body and you're not really caring about yourself or society or whatever, so you are just like, you know, doing whatever just like to have some sexual pleasure, let's say. And so many people are, and unfortunately facing this thing. You also asked me about the mental health situation. So many people that they hardly started dealing with this infection or living with their HIV infection started now also with the shame of being maybe people that could infect others around, only because other people around think that they would never care about their health as they did before that they got HIV. So I also have someone who's living with his parents now, and unfortunately now, like, since the isolation and quarantine is there is no other possibility for him to stay anywhere, and he's with his parents, and his parents are every single day telling him something really harsh. Please don't bring us any infection. This was something that affected you, the HIV, but now maybe you will kill us, not only kill yourself. And he's only like, finding it so hard to at least, how can I say, just like spend some times now out with friends that he can feel a little bit better and share this. No, but he has to stay with his parents. He has to always hear these words. And also there's another guy that also had the same thing with some people at the refugees camp. Okay, he's gay, and once he had some, I don't know, like he's allergic to some things. They had some red spots in his body some months ago, and then everybody was talking first that he's HIV positive. He's about to die or something, so he was living in the refugees camp. And afterwards now people are just, if he's just passing, for example, somewhere at the camp, everybody's just running, literally running, and nobody's just like caring about this or just clarifying the situation. Or maybe somebody has done this or they heard it at the media, but are just maybe also like over panicking somehow. But I mean, it's really hard, because he's gay, and he was before, like, he got HIV infection because he's just never caring about his health. And now he's, of course, keep doing this sexual connection that he will infect us. So yeah, I just had to mention this because it's some real examples alive that everybody maybe should just know about. Somebody is really suffering somewhere there, and we don't really know. And we're really just complaining about being isolated at very kind of comfortable atmospheres, having internet, 5 devices that we can entertain ourselves by. And some people, they don't have anything, even no one to talk to. Or they have to stay in a one room with 5 other people that they discriminate them, they are harsh to them all the time. So I think it's worth to be told somehow.
Yeah, that was mentioned also in the previous panel as well. Even if it sounds like a small point, but even having access to internet, having access to entertainment, to information, right? There's people that can do that, and there's other
your own freedom, at least, to be your own space,
Yeah. I have a question in between for you as well, Mira. I've been asked again in the chat if you could repeat the name of the organization you were talking about with the psychologists with LGBTQI background.
Yeah, sure. It's VLSP, so it's like VLSP.
Okay, right. So hopefully that's answered the question as well. There's another question that's come in. If you would like to, and the person says thank you as well. If Mira, one could explain the difference between sex work and looking at the best sex work and prostitution in your work.
Yeah, so I mean, it's kind of clear, but I mean, some people also, they get the allowance to, for example, have like official sex work, let's say at the weekend, and they prostitute for the rest of the week because they don't really need to pay some taxes sometimes. Some people, they have license to just like be officially, registered sex workers. With prostitutors, also it's really hard for them because they are going sometimes through the transition procedure, or like they have other difficulties that they need to bring themselves out of the accommodation they are living at or so. And they just like prostitute just without any registration, or so that they can earn some bit extra money at least to have a bit more security, because what they get from the government or like from the social offices are never enough. So, and they need to, so for trans people especially, they need much things actually, like during the transition procedure that mainly also it's not really taking so care from the health system side, and they don't get also like financially supported. So they basically prostitute, and yeah, and it's really hard for them because there's no laws to protect them. Sometimes clients are, you know, like having some fetishes, which is not, you know, something which is included for them, but they have to face it then. And they're always confronted with this weird clients somehow. And yeah, unfortunately, like it's something that we can't really change, but we can always talk about it, try to empower them, or just, you know, but yeah, this is the thing. And sometimes also like people that they have license only for the weekend, they really fear sometimes if one of them needed to go to the hospital because yeah, I wouldn't talk much about, but it was really harmful experience that she had, and she really needed to go to the hospital, and she didn't want it to go because if she will go there, then the police will be called, and then they will learn that she's not really doing it only at the weekend. And yeah.
We have less than 10 minutes. There's another question that's come in, and it's a question to both of you. What you see have been the efforts that have been made for queer refugees in the camps and access to information. What are your experiences? Ahmed, would you like to start? Can you answer
yeah,
that?
I mean, I think, but it's really different from here in Berlin. We have the situation of having a camp for queer refugees, and there has been there because of that already, like that sensitivity and that awareness of that we're working with queer refugees who don't access. There has been a lot of like information been circulating. A lot of people who are living in refugee camps are trying to get out right now because their worst fear is being quarantined in the refugee camp. So the efforts are mostly like trying to give people information, and at this point, because also we don't have a lot of time, I think it's important to mention that Berlin has been the first state in Germany to open access for people who don't have insurance to access healthcare services in doctor offices, and this has been decided just on the 15th of April. And I think this is a very important decision. And this is also one of the things that we're thinking, why didn't this happen before?
Yeah.
This is, of course, like being coordinated also with the Clearingstelle here in Berlin, which is organized by the Stadtmission. And yeah, when we're thinking about infectious disease, that must be the case. I work with a lot of people living with HIV who until right now don't have to access to HIV medication because they don't have insurance in Germany, and the German healthcare system is not a universal healthcare system. It's very much attached to like migration status or nationality and employment. So this is a huge gap, and I think this is again a lesson that we need to learn from this situation, that healthcare should be open to people so that we don't leave anybody behind.
Leaving no one behind. What would you say, Mira?
So concerning the LGBTQ camps, or like people where they mainly live, I mean, mainly it's a little bit also difficult to and mainly people are, before even COVID-19, they are always facing this problem of living with somebody who's like homophobic or transphobic at one room, and having this also like they are sharing the same background with them, so they are really judgy and they're really feeling uncomfortable with. And basically there's no much options here. So there's the gay camps here, or like the LGBTQ camp here, and there's some other places for people that they face violence and families, and so but it's sometimes overbooked and it's not really huge, so we don't really have much to help about concerning this point. And sometimes, I mean, I should say that also, like, there are so many nice people out there that they are working with refugees and they are really quite supportive. So we should never, you know, underestimate this nice power which is there also. But also, like, sometimes you just contact some social workers or Hausmeister or so, that you just explain the situation in a way that this person is really vulnerable and this person really needs some more privacy. It could be also like that his life may be in danger or so, and sometimes they never react. They say, okay, everybody's equal, we don't really have rooms, even though there are rooms sometimes, but they don't really find as anything special to offer for people. That, yeah. And sometimes when we go a little bit like through maybe like a longer process, going to a lawyer, bring some proofs from psychiatrist or so, then they react. But I mean, from the beginning, if the client is suffering for maybe 5, 6 months, 1 year even, they never really react. And it's really hard for me sometimes just to understand, if you are working with humans all the time, so where is your humanity somehow? You know, sometimes I face this. I should also say that I sometimes face totally the opposite, that people are really nice. They try to take better care of their clients. They ask me always for further information. But unfortunately, this is also, yeah, not always the case.
Yeah. We have less than 2 minutes. And that's always the case when as soon as you get deep into conversation. I have a quick last question. Like, if you could just give a quick demands. You started with it, Ahmed. You said access for all for healthcare, right? So is there something you would say now that NGOs, policymakers, people, lawmakers, if you could give one more kind of demand, what would it be?
Yeah, just very quickly, I think always there is this issue when we're talking about queer refugees and like kind of vulnerability, that we feel like this kind of like victimhood thing. And I think there is a lot of resilience there, because we have been through lockdowns before. We have been locked in places that we cannot leave borders before. And we always know this feeling of fear from everybody around us. So this is not really new for a lot of queer refugees. Just having said that, I think, yeah, of course, the demands we have also been doing for a long time. We see that refugee camps is not a space that can actually accommodate people, and we want different housing solutions. We don't want to be in refugee camps. We want to abolish them, and we want universal healthcare without barriers, and we want to address the issue of racism in healthcare systems immediately. And of course, we also want mental health services, because things are really stretched right now.
Thank you, Ahmed. Mira, very, very short, because we...
Yeah, sure. I just wanted to say shortly that, I mean, all of the queer refugees, besides what Ahmed said, like, they fled the war, they fled so many difficulties, but also they always they want to flee the people or their communities that they always felt really dangerous at. And please just like really consider this, because then we will reduce also the amount of seeking some psychological help if people are feeling secure here. And please just also like, just always keep in mind that also these people always have been facing different kind of discrimination even before the war started, or like any kind of insecurity situation started. So please just like keep this in mind and really consider that these people maybe need some extra help that could also be there for them at least, or for everyone that could just easily access the medical help. Yeah.
Thank you very much,
Ahmed
and Mira. That's been I'm pretty sure we've been getting some comments in the chat that people are taking a lot with them, and they've understood a lot more about the issues. And I'm pretty sure we're going to be staying in dialogue. And I thank you so much for your knowledge and your time and sharing that with us all online. So thank you. So I would now then say to the viewers as well, there is one more session. It's starting in 15 minutes. It's with Philip Brown. It's on legal services. There are perspectives from lawyers and NGOs, so please stay tuned. Grab yourself a cup of tea or whatever you like to drink. And yeah, I would say from this panel, goodbye. And again, thank you, Ahmed and Mira, for your time and for your knowledge.